Today, I will talk to you about a procedure that can be performed without surgery, the opening of the carotid artery blockage with a stent. This procedure has saved millions of lives in the last 20 years, and carotid artery blockages can now be opened without the need for surgery. Let me tell you a bit about this procedure. Carotid artery blockage, along with heart rhythm disturbances, is one of the most common causes of stroke, which is the occurrence of a blood clot causing a blockage in brain circulation. Do not underestimate the importance of the carotid artery. It carries blood flow to the brain on both sides of our neck. Almost all of the brain's blood circulation is provided through these carotid arteries that rise upward from both sides of our neck. When carotid artery blockages exceed 50%, the risk of stroke increases. So, who is recommended for the stent procedure? If a patient is at a high risk for surgery, has previously undergone radiation therapy or treatment, or has had a previous surgery in the neck area resulting in recurrent narrowing, stenting is the only solution for these individuals. If the carotid artery blockage is 100%, meaning blood flow on one side has been completely lost, then we do not intervene because the damage has already occurred, but brain circulation has been preserved. What matters to us is whether there is narrowing on the other side. We do not intervene in completely blocked carotid arteries. For blockages between 50 and 99%, angiographic procedures are necessary. The diagnosis is made using carotid artery ultrasound. In cases where there is uncertainty in the carotid artery ultrasound results, a tomography can be performed to confirm. If carotid artery blockages reach or exceed 50%, it should be evaluated whether intervention is necessary. If a patient has experienced a stroke or brain clot within the last 6 months and the blockage in the carotid artery is over 50%, then the artery should be opened. This is because blockages exceeding 50% that have led to brain clotting in the last 6 months indicate a high risk, and the carotid artery needs to be opened. Now, let's say there are no symptoms. In these cases, during routine checkups, if we observe a narrowing of over 70% in the carotid artery, the artery needs to be opened. This is because clots that form in this region can travel to the brain and have life-threatening consequences. Carotid artery blockages are significant conditions and can now be treated without surgery through state-of-the-art interventional procedures. In cases where we observe stenosis on a tomogram, or sometimes even through angiographic procedures without the need for tomography, we visualize the carotid artery using angiographic procedures entered through the groin artery. If the degree of stenosis is critical, we proceed to open this artery. The procedure is performed once again through the groin artery. We advance through the groin artery and, with the help of a catheter, reach the carotid arteries emerging from the aorta, placing a filter in the upper part of the carotid artery. This filter is essential during the procedure to prevent any potential clots from reaching the brain and to avoid any harm in case the plaques tear. In other words, this filter provides significant protection for the patient during the procedure. After placing the filter, we bring the stent and open it at the site of the stenosis, covering the narrowing. It's important to note that the goal here is not to completely eliminate the stenosis, but to significantly reduce the risk of clot formation in this area when it's covered with a stent. The risk of the procedure is already below 3%, and if it exceeds 3%, this procedure is not recommended. Carotid artery stenting in cases of stenosis